Thematic analysis of open-ended questions to explain the reason behind choosing ECG and PFT as electives. We can see here 42.28% remarked that they wanted to learn the topic as they thought that it will help them to become a good clinician in future. 37.93% choose it due to its clinical relevance, and 6.9% replied they were interested about the topic. It was shown in table 4, and figure 4 shows the graphical pattern of this thematic analysis. Now, thematic analysis of responses regarding the positive points of electives. It has identified 5 themes, that is clinical exposure, diagnostic skill, knowledge expansion, practical skills, and overall general positivity. Maximum students pointed out gaining diagnostic skills and expansion of their knowledge as the eminent admiring point of these modules. Now, the thematic analysis of the reactions regarding negative points of the electives identified 5 sub-themes. For more exposure to clinical cases, it was a cause. They needed more exposure and shorter duration, only 15 days. 26.66% students said that only 15 days it is not sufficient for this elective module. Table 7 demonstrates suggestions referred by the students to improve the elective module. Majority inferred that the program was excellent and nothing to suggest. 32.14% students concluded that at least 1 month duration is needed, and 17.87% suggested more case discussion of abnormal ECG and PFT are required to have a sound grip on the subject. Now, this is the perception of medical teachers. It is a graphical representation of it. in this actually we can say that the teachers, the faculty member, they indicated the objectives of the electives were predominantly achieved. A considerable number of faculty members expressed the students demonstrated receptiveness to their educational needs and proactively engaged in the elective activities. Now, regarding the focus group discussion, so the theme 1 was necessity of elective modules on ECG and PFT as a part of clinical relevance, and theme 2 was the program satisfaction, and theme 3 is the deficiencies of present modules as perceived by the participants, and theme 4 was the improvement strategies. So in theme 1, the students said that one of the students that I wanted to learn the procedure as it is of great importance in clinical practice and has many diagnostic values. Another student said that I wanted to have an hands-on practice so that it will help me in clinical scenario. Theme 2, that is program satisfaction. One student said that I had opportunities to perform the test on my own and got chance to communicate with patients. Basic concepts were clear with clinical interpretation, it was told by another students. Theme 3, deficiencies of the present module. Most of the students said that only 14 days time is very short to learn such clinical procedures, and more theory classes are needed to understand abnormal ECGs. Improvement strategy. One student said that the time duration should be at least 1 month. There is another student said there is nothing to suggest, it was excellent. Another student also very interestingly said that there should be an arrangement for refreshment on the day of presentation. Now, these are the positive points mentioned by the student, by our teachers. The strength of the individual interactions of teachers and students, since the number of students is small, so every students get equal opportunity to clear the misconception. This was the main positive points as found by our faculties. And they also thought that it will help the students to have a taste of their area of interest, also will increase the students confidence. And some of them also thought in-depth study in the modules and hands-on approach is a very good point about it. Regarding the negative points, our faculty member pointed out that duration was limited to get full confidence or control over the test. Integration with clinical faculty is lacking, and this can be considered a weakness. And infrastructure of all medical colleges are not uniform. For example, we are the rural medical college, so students of rural medical college like us are getting less exposure to super specialty departments. Now the discussion. Most of the students said that the elective program made their expectations. They had adequate opportunities of hands-on clinical work and also had sufficient supervision. Electives awaited them to secure proper communication skill with patient, to accomplish how to deal with co-workers and other staffs in working environment, and how to comply as a team. Students' perception was very optimistic regarding the elective module. This agrees with the studies done by Cooper et al. In 2015 and Essen-Sedel et al. In 2016. Elective provided, the students told that elective provided them with the scope to demonstrate their integrity and lateral thinking, and they also achieved a new outlook about preclinical subject. This result is in accordance with the studies done by the Vandenbreck in 2017. Regarding the implausibility of the program, most of the students responded that there were none. However, some said that it was not as expected due to the busy schedules of the faculty members. Harvey et al., Ramalho et al., Vandenbroek, and Wu, Greenberg, and Agarwal reported the identical findings. Students gave some important recommendations regarding the program too, most of them propounding increasing the duration of electives. It will be more effective. During the interview session, almost all students acknowledged they have gained erudition or knowledge on the topics, and these upgraded their ability to interpret result of ECG and PFT in clinical settings. And this corroborates with the quantitative analysis. As it is a mixed method study, in the quantitative analysis, we have also seen that there is significant increase in posted score. So knowledge gain is there. So now come to the perception of the faculty. So faculty member recognize the electives as a means of expanding one's knowledge, where most of the faculties perceived no weaknesses in this program. Some noted that duration is limited, and some of them also pointed out integration with the clinical faculty are lacking, and this can be considered as a weakness. Now what about the SWOT analysis of this program? The strength is it is a mixed method design, so it provides robust triangulation. It is statistically significant improvement in the knowledge gain, 100% attendance and high engagement, positive perception from both students and faculty, validated tool and ethical clearance. So these are the strengths. Weakness, small sample size and single institutional study, short duration, infrastructure limitations as it is a rural medical college, lack of integration. And opportunities, scalable model for implementing elective across other preclinical departments. Now longer duration, more clinical case discussion can increase the quality, and faculty development and interdisciplinary integration can also improve the study. What are the challenges? Faculty time constraints, non-uniform infrastructure, possible resistance to curriculum change, and risk of electives being treated as formally without adequate supervision and feedback mechanisms. Now regarding the critical appraisal of the study, we have done it by two methods. One is the mixed method appraisal tool criteria. Here we can see that the research question, it was clear. Data collection methods, it was appropriate. Relevant integration and qualitative data, it was also done. Adequate interpretation of integrated results was also done. Coherence between data sources, collection, analysis and interpretation was done. Another method is EABLE format appraisal, that is E for evidence strength. It is a small single center study, but statistically it is robust. A for applicability is moderate, so limited generalizability beyond the institution. B is a bias risk. Purposive sampling and lack of binding could introduce bias. However, validation and FGD reduced this. And L for limitations, a limited sample size, no longitudinal follow-up and confined to one department and batch. E is the educational value, that is high, provides strong rationale for preclinical electives, supports transformational and hands-on learning. Now translatory component actualized. This is the educational objective alignment is one. Skill based learning, knowledge translated into hands-on clinical consequences. Active and participatory methods promotes learner-centered pedagogy. Faculty development and engagement encourages faculty ownership and scaffolding of practical learning. Improvement of recommendations provides a feedback loop for institutional curriculum revision and future enforcement. And thematic validation confirms construct validity of elective modules. And research informed practice, that is, it adds to evidence base for medical education. Now, the contribution of this project to the scientific literature. So, novelty in the context, one is this. Another is the evidence based evaluation, combine quantitative and qualitative both. So, demonstrates statistically significant knowledge gain. Second, the third is the policy implications, that it supports the continued inclusion and expansion of electives in undergraduate medical curricula, provides feedback based suggestions for improvement that can inform national and institutional guideline. Pedagogical contributions, that is highlights transformative learning through electives with students autonomy and reflect tactics and critical thinking. It also validates the importance of hands-on experience and active learning. Faculty insights adds perspectives from faculty which are often underrepresented. And recommendations for curricular designing suggests this study suggests practical strategies like increasing duration, case-based discussion, improved coordination or integration. It can be adopted in future. Now, conclusion, this study depicted a successful implementation of electives in physiology department, emphasizing the potential of preclinical subject as a topic for electives. Students' positive approach impel us for its continued promotion and expansion. The faculty's insight also offers constructive recommendations for improving this module. Now, limitation, it is done on a single medical college with a single batch of MBBS students. Including more batches and greater number of medical college will give a better view. Now, these are the references. So, these are our students. Thank you.